So let's discuss about a condition called macrocytosis. So what is macrocytosis? So we all have red cells in our blood, which gives a red color to our blood. If you look at the blood test report and you look at what is called MCV, which is mean corpuscular volume, this gives indication as to the size of the red cells. A normal person has an MCV of 80 to 100. Less than 80 number is called microcytosis, or small size red cells. More than 100 is considered macrocytosis, which means the red cells are larger size. Large cells by itself do not cause problems, but they indicate presence of problems elsewhere. So let's look at the potential causes of macrocytosis. The main important cause is B12 and folic acid deficiency. So when you have the deficiency of these vitamins, the size of the red cells increases and the MCV tends to get higher. And when you look at the blood count, you see the high MCV, then you know there might be some problem along those lines. The other common condition include certain medications used in chemotherapy, such as 5-FU, hydroxyurea, methotrexate, azathioprine, capecitabine can lead to macrocytosis. In addition, a medication such as imatinib, which is used in chronic myeloid leukemia, can lead to the same problem. And medications such as sunitinib, which is used in kidney cancer patients, can also lead to big size cells. The other medication that can potentially cause macrocytosis include zidovudine, which is used in HIV patients. Also, anti-seizure medications can also lead to a large size cells. A bone marrow condition such as aplastic anemia, myelodysplastic syndrome, multiple myeloma can lead to big size cells. In addition, patients with a liver disease or underactive thyroid and high lipid levels can lead to big size cells. And of course, the alcohol abuse, if you're taking alcohol on a regular basis, it can lead to big size cells. What we call it macrocytosis. And this is a common sign that you see in people who take alcohol on a regular basis. And typically when you stop alcohol for 2 to 4 months, the size of the cells return back to normal. So when you have macrocytosis in the labs, or the size of the MCVs, or the MCV is high, then what do you do next? We typically order some testing to rule out underlying conditions that can cause large cells. And so basically the testing will include, checking your B12 levels and folic acid levels, and checking your spleen size, asking the history for alcohol, or asking for thyroid problems, looking for underactive thyroid, looking for liver disease, and so forth. And then you basically find the problem and you do the treatments to address the cause of the problem. So for example, if the large size cells is because of alcohol intake, we ask people to abstain from alcohol. If there's a B12 and folic acid deficiency, we suggest B12 and folic acid supplements. If there's an underactive thyroid, we recommend thyroid supplements. And then if we find out the patient has a bone marrow problem, like myelodysplastic syndrome, multiple myeloma, and that will be treated appropriately. So in summary, the macrocytosis means large size cells, and then in the blood count, the MCV will be high. And so when that happens, we know there are certain things that is happening. Then we do the testing to find out what's causing that large size cells, and we treat it accordingly, according to the etiology. And then we correct any vitamin deficiencies that may come up in the testing. Thank you for watching this.